Which color wristband typically indicates a fall risk? Correct answer is yellow. Which age group needs the most sleep? Correct answer is infants. Which artery is commonly used to check the pulse in infants? Correct answer is brachial. What should a nurse do before administering digoxin? Correct answer is check apical pulse for 1 full minute. Normal adult urine output per hour should be at least. Correct answer is 30 ml. The Braden scale is used to assess risk for. Correct answer is pressure ulcers. Which symptom is a classic sign of a heart attack in women? Correct answer is nausea and jaw pain. Which nutrient is most important for wound healing? Correct answer is protein. Which is a sign of post-operative hemorrhage? Correct answer is tachycardia and low BP. Which wound color suggests infection? Correct answer is yellow. Which site is best for an intramuscular injection in an adult? Correct answer is deltoid. What is the normal pH of urine? Correct answer is 4.5 to 8. Which test is used to monitor long-term blood sugar levels? Correct answer is hemoglobin A1C test. Which sign indicates orthostatic hypotension? Correct answer is dizziness on standing. Which lab test reflects protein status? Correct answer is albumin. To reduce risk of post-operative pneumonia, the nurse encourages. Correct answer is incentive spirometry. The nurse should withhold digoxin if the apical pulse is. Correct answer is 60 beats per minute. Which is the best position for a patient in shock to improve circulation? Correct answer is Trendelenburg. A pulse oximetry reading of 86% indicates. Correct answer is severe hypoxia. Before feeding a stroke patient, the nurse must first. Correct answer is check gag reflex. A tympanic thermometer measures. Correct answer is ear temperature. Which position promotes optimal breathing in a dyspneic patient? Correct answer is high Fowler's. What is the best position for administering a rectal suppository? Correct answer is left lateral, SIMS. Perineal care is most important in which patient? Correct answer is one with a catheter. Which position is best for rectal medication administration? Correct answer is AIIMS position. A patient tells you they feel butterflies in their stomach before surgery. This is an example of. Correct answer is an emotional response. The best site to check the pulse in an unconscious patient is. Correct answer is carotid artery. Which vital sign is most critical to monitor in a postoperative patient? Correct answer is respiratory rate. A patient is allergic to penicillin. Which antibiotic should be used with caution? Correct answer is cephalosporins. What is the first step when measuring a patient's blood pressure manually? Correct answer is make sure the arm is at heart level. Which position is best for a patient experiencing difficulty in breathing? Correct answer is Fowler's position. The most accurate method for measuring core body temperature is. Correct answer is rectal. Which type of isolation is required for a patient with an open wound infection? Correct answer is contact precautions. A patient with fluid overload may have. Correct answer is edema and shortness of breath. A patient with a severe allergic reaction should receive which medication first? Correct answer is epinephrine. A patient with liver disease is at higher risk for. Correct answer is slower drug metabolism and toxicity. The term nosocomial infection refers to an infection that is. Correct answer is hospital-acquired. When lifting a patient, the nurse should. Correct answer is use leg muscles to lift. Which sign indicates hyperkalemia, high potassium levels? Correct answer is muscle weakness and irregular heartbeat. A patient is drowsy and has low oxygen saturation in the post-anesthesia care unit. What should the nurse do first? Correct answer is encourage deep breathing. A common cause of constipation in hospitalized patients is. Correct answer is opioid medications. Break time is equal to 2. 5s. An IV site should be checked for complications. Correct answer is every hour. Informed consent must be obtained by the. Correct answer is physician or provider. Pain that continues beyond normal healing time is called. Correct answer is chronic pain. Using silence in communication helps too. Correct answer is encourage reflection. Which factor increases the risk for constipation? Correct answer is immobility. What is the most serious risk with IV therapy? Correct answer is air embolism. A patient with low albumin is likely suffering from. Correct answer is malnutrition. Which electrolyte is most closely related to muscle contraction? Correct answer is potassium. A patient with muscle cramps and flat T waves likely has. Correct answer is hypokalemia. What is the most important nursing action during digital removal of feces? Correct answer is monitor heart rate. Which documentation error can lead to legal consequences? Correct answer is charting before providing care. Which oxygen delivery device gives the highest concentration? Correct answer is non-rebreather mask. What is the purpose of anti-embolism stockings? Correct answer is prevent DVT.